Hello, my name is Kelly Briggs, and I'm a Maryville University nurse practitioner student, and this is my abdominal assessment demonstration video. This is Kevin. He is a 36-year-old male. He will be my patient for the day. All right, Kevin, if you could please lay down. The first thing that you want to do during an abdominal assessment is you want to approach the patient from the right side. All right, you're going to have him lift up his shirt to expose the abdomen. All right, and you can draw an imaginary line separating the abdomen into 9 separate quadrants, or 4, depending on the clinician's preference. And the first thing you want to do is you want to inspect the patient's abdomen, noting that his color is normal for his tone. There is no jaundice or cyanosis present. There's no superficial venous patterns present. If there were superficial venous patterns present, how we assess the venous return is we actually take both of our index fingers and we press firmly, spreading them apart, and then you release one, and then you assess the pattern of venous return, whether it's going from the umbilicus up towards the head or the umbilicus down towards the feet. We also want to take a look at the umbilicus, noting that it is not protruding, which is a normal and expected finding. There's no bluish area around it, which if there were, that could indicate that there's an intra-abdominal bleeding present. It is midline. The next thing that we want to do is, Kevin, if you could please lift your head slightly. This helps to contract the rectus abdominis muscles. We want to note that there's no separation present. There's no hernias or masses noted. All right, you can go on ahead and lay back down. The next thing that we want to do is we want to auscultate the patient's bowel sounds using the diaphragm of our stethoscope. And we'll go in a clockwise motion. All right. And there's audible clicks and gurgles present, which is a normal and expected finding. Kevin has about 35 bowel sounds per minute, which is also a normal and expected finding. The next assessment that we want to perform on the patient is we want to auscultate his abdominal arteries. We want to listen with the bell of our stethoscope. Typically, the renal arteries are about 2 finger lengths laterally and inferior to the umbilicus. We want to note that there's no bruits present in the renal arteries. Next, we want to go laterally and distally, listening to the iliac arteries, noting that there's no bruits present. We want to take a listen to the aorta. All right. And then next, for purposes of this video, we won't have him take his clothes off, but we want to auscultate his femoral arteries, noting that there's no bruits present on the patient's femoral arteries. The next thing that we want to do is we want to perform percussion on the patient's abdomen. We'll start with the 4 quadrants. Noting that there's tympany in all 4 quadrants, which is a normal and expected finding. The next thing we want to do is we want to percuss to estimate the size and location of the liver. We want to start at the midclavicular line, and we want to note areas of resonance to dullness. And then we want to move back up, noting areas of tympany to dullness. All right, and we assess that this area right here is about where the liver is located. Next, we want to percuss the patient's left side for the spleen. noting areas of resonance to dullness. And we've located it at about the 8th rib, which is a normal and expected finding. The next thing that we want to do is we want to percuss to identify the patient gastric bubble. And we move from the midclavicular line up until the epigastric area, noting that the tympani is a little bit higher in pitch than the rest of the abdominal areas, which is also a normal and expected finding. The next thing that we want to do on the patient is we want to start with light palpation, about 1 centimeter deep, noting that there isn't any masses, bulges, or hernias present on the patient. All right. Is there any pain or tenderness? No? Okay. The next thing we want to do is we want to move on and do some deep palpation of the patient, noting that there are still no masses or bulges or hernias present. We want to palpate the rectus abdominis muscles, noting that there's no separation. All right. And then the next thing we want to do is we're wanting to take our non-dominant hand and place it posteriorly, pushing upward to bring the liver closer to the anterior surface so we can palpate the patient's liver. Kevin, if you could take a deep breath in and out for me. All right. And we want to note that his liver is not palpable, which is also a normal and expected finding. We're going to do it on the patient's left side. Take a deep breath in and out. All right. Noting that the spleen is also not palpable, which is also a normal and expected finding. We want to palpate deep laterally, and I want the patient, if you could please take a deep breath in. All right. Do you have any pain or tenderness? All right. That's checking for Murphy's sign. If he was to experience any pain or tenderness, we would know that he might have some cholecystitis present. The next thing that we want to do is we want to try to palpate the patient's left kidney. All right. And his left kidney is not palpable. That's also a normal and expected finding. And we're going to go on ahead and try to palpate the patient's right kidney. All right. And we want to note, is there any pain when I do this, Kevin? No? Okay. And we want to note that it is smooth and firm and non-tender, his right kidney. The next thing that we want to do is we're going to perform some fist percussion to the posterior surface bilaterally between the costovertebral angles on the patient's back. If you could please sit up for me, Kevin. All right. Kind of sit and cross your arms across your chest. All right. Is there any pain or tenderness noted? Oh, no. Bless you. All right, great. And that is a normal and expected finding. And that is all on my abdominal assessment video. Thank you for watching.